Hey, Jim Hoffman here from EMS Office Hours, and this is your Monday Minutes. Today's Monday Minutes, I wanted to just talk a little bit about a technique that you can use when you've got a difficult intubation, or maybe even a not so difficult intubation, just to further help you successfully intubate patients. Of course, in the field, and what we're trained is looking for the vocal cords. And of course, we would like to see, every time we intubate somebody, a nice, clean picture of vocal cords. This is what we want to see. But of course, it's not always the case. We don't always get to have that luxury. Airway management is one of the biggest challenges in EMS and for providers, and especially when you've got coming into question our success rates in intubation and whether or not we're performing it properly and safely. So when you have difficult airways to try to intubate, using something called this BURP maneuver can actually help you when it comes to doing that. So what is BURP? Well, it's a backward, upward, and rightward pressure of the patient's larynx. And what this does, this can actually improve the visualization of the structures inside the airway, and mainly, of course, the vocal cords, and it eases your intubation. So right here is just a quick little description. Again, BURP, it's backward, upward, rightward pressure. Now I have a quick picture here for you to look at, just to kind of give you an idea what you should be looking for. Now backward is the first thing you want to do, and that, when we say backward, we're talking about pressing down towards the patient's spine, towards their back. And then upward and rightward, you're kind of doing that in the same sort of motion. So what you're doing is, again, you're putting backward pressure on the thyroid or those cricoid cartilages, and this is that back maneuver. And then what you're going to do is you're going to add that movement of the larynx in a superior motion, or upward, and then you're going to displace it towards the right. So again, backward, upward, rightward pressure of that larynx. And this is going to actually wind up displacing the thyroid cartilage in a way where the larynx is going to be pressed against that cervical vertebrae and be able to go ahead and bring those vocal cords into view. Now here's another quick picture of the rightward pressure, just so you just kind of see what you're doing. Now you want to grab onto the cricoid cartilage, the cricoid ring there. You'll feel like where you would do normally, let's say, do your needle cric. Right there is where you're going to push it. You're going to push down on it, push upward, and then towards the right. And I think you're going to find that it's going to bring those vocal cords into view for you. So what happens when you do that, instead of seeing this, where you see nothing, and maybe the esophagus, you're going to be able to, once you do that BURP maneuver, is you'll be able to see something like this, where you can actually see the vocal cords and be able to intubate the patient safely and easily, much easily, and get a advanced airway for difficult airway patients. So I suggest you go ahead and try it the next time. Some of us might already know about this. I mean, I was at a continuing education class recently where I was aware of it, and some other paramedics in the class were aware of it, but some were not, and I was a little surprised that some of the paramedics were not really aware of this BURP maneuver. And it's been around, I believe, since 1993, when it was introduced and kind of described back in 93. So again, try it out, guys. If you, next time you have an airway, if you don't see the vocal cords right away, instead of playing around and poking around in there and trying to get more leverage and putting stuff under the patient's shoulders and all that good stuff, try the BURP maneuver first, and I think you're going to find it a little bit easier to see the vocal cords. One thing to mention is that you can actually do this on your own as the intubator, especially if you work with an EMT partner or someone who's not familiar with this procedure. You can go ahead and do the maneuver on your own, and then just tell your partner exactly where to hold and replace your hand with theirs. and hold it in place as you go ahead then and take the tube and pass it through the cord. So of course you can't do this on your own. It's going to take more than just 2 hands to do this, but if you're familiar with the procedure, you can go ahead and manipulate the larynx into position and then have your partner hold that position as you pass the tube. Occasionally when you do that, when you let go, it might shift just a little bit because they're not anticipating that pressure, so just adjust it a little bit to bring them back into view again for you, and then pass that tube. Of course, check lung sounds, and don't forget to confirm with end tidal capnography. Okay, guys, that's it for this Monday Minutes. As always, visit emsofficehours.com for more Monday Minutes, for the archives of the podcast, and in addition to some other commentary articles and some training information over there as well. And I hope to see you in my members list as well. You can join the members list over at emsofficehours.com. Also, until next Monday, this is Jim Hoffman, and as always, stay safe.